When one becomes two. Ben Carson, a young, intelligent, upcoming neurosurgeon, created a well-known medical frontier in 1987. He was given a case that would forever change his life, the Binder family's life, and medical history. He was given the task to separate 7-month-old German Siamese twins, Benjamin and Patrick Binder. He was able to separate the twins through an operation that involved hypothermia, circulatory bypass, and deliberate cardiac arrest. On September 2, 1987, Ben Carson, a neurosurgeon at Johns Hopkins Hospital, performed the first ever successful separation of conjoined twins on 7-month-old Patrick and Benjamin Binder. This medical frontier led by Dr. Carson created a more reliable way of performing the separation of craniopagus, conjoined at the cranium twins, and forever changing the lives of many. This medical frontier relates to this year's theme, Frontiers in History, People, Places, and Ideas, because before Carson's operation, there had been many unsuccessful attempts to separate this rare medical condition that were considered anatomically impossible, unsafe, and unreliable, or one of the twins acquiring an incurable disease. Dr. Ben Carson was able to come up with the idea to perform a hemispherectomy, an operation where half of the brain is removed on the twins. His idea for this operation took 3 types of procedures that had never been used together before and used them in one operation. After completing the surgery, he was then able to perform multiple of these operations on other conjoined twins, like the Binder twins, such as Leah and Tabitha Block, who were separated in 2004, or the Makwiko twins from South Africa, who were separated in 1994, sadly resulting in one of the deaths of the twins. This created a more reliable way of performing the surgery that could go on to change lives of not just the twins, but their families as well. It even gave them the chance to live the most typical life they could. This medical frontier allowed the twins to be able to walk, crawl, and turn over on their own, which had not been possible before this surgery. It even gave them the chance to be able to look at each other because they were previously connected facing away from each other. Since then, he was able to give other twins all over the world the same opportunity, forever changing their lives. In Ulm, Germany, on February 2, 1987, Joseph and Teresa Binder had Patrick and Benjamin. They weighed 8 pounds and 14 ounces combined. Doctors told Teresa and Joseph their sons would be healthy babies, except they had no chance of walking, crawling, and turning over on their own. Teresa's first reaction of the twins was, "My God, what will they look like? How will they live?" she reported to Washington Post. 1 in 2 million births that occur are conjoined craniopagus twins, also known as Siamese twins. Doctors still don't understand what causes this. It is believed that when twins grow from one egg that does not completely separate. The first record attempt to separate conjoined twins was on sisters in 1690. The first separation was performed on Zygopagus twins who were only joined with a band of tissue and skin. The unsuccessful operation was attempted by having a ligature around a band that was tightened daily until the last bit of skin was separated by a knife, which resulted in both twins not surviving. Similar cases like Maria and Rosaline, who were thrombocoses twins that were separated in 1900, also resulted in one of the twins surviving. Alike operations would continue to go on, resulting in 26 more unsuccessful attempts to separate conjoined twins. Until Ben Carson came along. He was born in September 1951. He was a troubled child who struggled with his temper in school. He was known as the dummy of his class. With the help of his mother, who couldn't even read herself, and his teacher, he began to succeed in school. He soon graduated high school at the top of his class and got a scholarship to Yale University, where he majored in psychology. After graduating, he began his journey to become a doctor at Johns Hopkins Hospital. At the age of 33, he became the youngest chief of pediatric neurosurgery. At the beginning of his career, he focused on pediatric tumors and brain reconstruction, but then began to specialize in conjoined twins. He was first presented with the case of the Binder twins in 1987. 7 months after the birth, the case reached Carson in Baltimore, Maryland. Hesitant after first taking the case, knowing how difficult it was going to be to separate twins without the death of one or permanent damage, it was considered impossible. But he knew it was the only twins' hope for life. He strategized for weeks trying to find a possible, successful way of separating them. Months after struggling with this medical frontier, Dr. Carson was able to find a way to separate them that would keep both twins alive and not give them permanent brain damage. Carson and a team of over 25 surgeons and nurses began rehearsing the hemispherectomy. Carson and Craig Duffin, Mark Rogers, and David Nichols would fly to Germany to prepare the boys for the surgery by placing balloons under the twins' scalp to help stretch the boys' skins, which we needed to cover their skulls once separated. They practiced every move of the surgery for 5 months, just in case something was to go wrong. They had 3 5-hour dress rehearsals in preparation. The team even had assigned spots to stand in during the operation. They practiced on life-size dolls joined together by Velcro for months. Luckily, the twins did not share the same brain and had 2 separate brains. After months of preparation, Benjamin and Patrick went in for surgery on September 5, 1987 at 7:15 a.m. News outlets gathered around the hospital to get photographs of these rare twins or to get an interview with Dr. Carson and his team. The twins then went back for their life-changing surgery. After lots of preparation, the surgery began. Anesthesiologists gave the baby medicine to put them asleep during the procedure. Surgeons specializing in the heart went in with hair-thin tubes in their veins for hours, and then connected them to heart-lung machines that would keep them breathing throughout the surgery. The scalpel was then passed to 5 plastic surgeons to slice through the tissue in the scalp to remove the bone tissue that was connecting the two. Then cardiologists cut openly on their chest to remove small amounts of their tissue from their heart to be later be used to reconstruct the veins. Before making the big cuts, the twins' heart rate was then dropped and their body temperature was dropped down to 68 degrees Fahrenheit, putting them in hypothermic arrest. This was an unheard of technique of separating conjoined twins. Their heart rate was dropped so they continued to operate without blood flow. The pressure was on. A large clock hung up on the wall counting down the hour they had to perform the procedure. If they preceded this limit, it could cause permanent damage or death to one of the twins. In Carson's book, Gifted Hands, he stated, "When the hour's up, just turn the pumps back on. If they bleed to death, then they'll bleed to death. But we'll know this is the best we could do." It was then Carson's turn to perform this life-changing surgery. He severed the primary vein that connected the twins. Using the tissue that had previously been taken, they began to make new veins in the brain. Both twins were separated, one finished in 57 minutes and the other in 63. Once separated, they had 44 minutes to rebuild their veins. Once finished, one of the surgeons shouted, "It's done." For the first time in history, conjoined twins were separated. For the next 3 hours, the doctors fought hard to control the bleeding that had been caused during surgery. The doctors had to constantly replace the boys' blood because they kept losing so much, until there was no blood left in the hospital. Carson had to call all over Baltimore to see if anyone had any blood to save the twins' life. Finally, it was found in a Red Cross blood bank where they only had 10 pints, which was exactly what was needed. Both twins were put in a medically induced coma due to the impact of surgery. This was the first time conjoined twins had been successfully separated. It was also the first time it was attempted to separate Craniopithecus twins. They immediately already had a better chance of surviving after being separated. After this medical frontier occurred, the twins had woken up and they were no longer under stress, and their medically induced comas for around 3 weeks. Once they had received therapy, they began crawling and moving on their own. 7 months later, the twins went back home to Germany. For the next few years, there was not much known about the twins. Ben Carson wrote letters and tried to reach out. He did not receive anything back. The twins and their family continued to keep their low profile. It was later sadly found that Benjamin had passed away at the age of 3 due to loss of oxygen when he choked on a piece of food. Patrick continued to live a somewhat normal life. He was able to efficiently get around on his own, but still needed some assistance from his mother, and was unable to live on his own or get a job. He was able to still communicate, sit, and eat on his own, which would not have been possible without the separation from his brother. Carson continued to stay in the media. He was interviewed by many news outlets. He then wrote his book, Gifted Hands, and he had a movie made about him, Gifted Hands, The Ben Carson Story. He continued his career as a neurosurgeon and went on to separate other sets of conjoined twins like the Binder twins. This procedure would go on to be performed 3 more times in Johns Hopkins Hospital with the help of Dr. Carson. This frontier was also performed at least 2 more times since 1987 in other hospitals in Southern Africa. After working in neurosurgery, oncology, plastic surgery, and as professor for over 30 years, Carson retired from the medical field. He began getting into the political U.S. field. In the 2016 election, Carson ran for president under the Republican Party. He did not win, but became the 17th Secretary of Housing and Urban Development. Ben Carson's separation of Craniopithecus twins through a hemispherectomy on September 5, 1987 at Johns Hopkins Hospital created a more reliable and safe way of separating conjoined twins. It forever changed and will go on to change the life of the families and conjoined twins, as inspired many others to take risks because it is the key of his operation is taking risks. This surgery was considered impossible to perform, and Ben Carson was able to perform a method of surgery that would go on to change the life of many. This medical frontier would go on to safely separate twins and give them normal life without severe damage. Ben Carson changed the Binder twins' life and turning one into two.